Dr. Molyn Leszcz is a professor, Department of Psychiatry, University of Toronto. He served as psychiatrist-in-chief at Sinai Health System from 2006 to 2017, and as vice chair clinical for Department of Psychiatry, University of Toronto from 2010 to 2017. Dr. Leszcz's academic and clinical work has focused on improving integration in psychiatric care and broadening the application of psychotherapy within psychiatry. In addition to more than 100 journal articles and book chapters, he co-authored with Irvin Yalom the 5th edition of The Theory and Practice of Group Psychotherapy in 2005. The 6th edition will be available in the spring of 2020. A co-authored book in the Psychotherapy Essentials to Go series, Achieving Psychotherapy Effectiveness, was published in 2015. An earlier edited book is Treating the Elderly with Psychotherapy. Dr. Leszcz was awarded the Alonso Award for Outstanding Contributions to Psychodynamic Group Therapy and was also awarded Distinguished Fellowship in the American Group Psychotherapy Association. He has been the recipient of a number of education teaching awards at the University of Toronto. Dr. Leszcz has been a member of AGPA since 1985 and is currently a member of the International Board for Certification of Group Psychotherapists, the editorial board of the International Journal of Group Psychotherapy, the board of the Group Foundation for Advancing Mental Health, as well as having served as president-elect for the past 2 years. He was the inaugural co-chair of the Science to Services Task Force. In addition to these impressive credentials, I want to add a little more about him. I've had the privilege of working closely with Molyn for the past 2 years. He's a pleasure to work with. He's generous with his time. I've never heard him say anything would be too much work, and he gets things done and done well. He is also generous in spirit and works to see and bring out the best in people. AGPA will be in excellent hands with our new president, Dr. Molyn Leszcz.
The title of what I want to speak to you about today is Everything I Need to Know I Learned in Group Therapy. But before I move into that, I wanted to make a few more introductory and general comments. I'm very grateful for the opportunity to speak to you all today. Like many here, I have great respect and affection for Anne Alonso. I recall vividly seeing something happen with her that is highly unusual at scientific meetings at the University of Toronto. A number of years ago, I organized a group therapy conference at the university. I invited Irv Yalom, Roy McKenzie, and Anne Alonso to speak. It was a great day. And Anne, who was less familiar at that time to the audience than were Roy and Irv, was the last presenter of the day. She spoke about the supervisor's role in the development of the trainee in such a powerful, impassioned, and meaningful fashion that she received the first resounding standing ovation I've seen at a scientific meeting. It is a great honor to be on this podium with the people who've worked so hard to organize AGPA Connect, with Marcia Block, our CEO, and with Eleanor Councilman and Nina Brown, our new distinguished fellows. I'm very grateful to the hard work of Alexis Abernathy, Tom Stone, Katie Steele, who's not here right now this morning, Nancy Kelly and Keith Rand, and all the many people who work to make AGPA and AGPA Connect a success. Both Eleanor and Nina have advanced our field and served AGPA in so many essential ways. I hope that you savor our respect and affection and appreciation. Eleanor, it has been just a pleasure to work with you over the last couple of years. I can't say enough about the spirit in which you approach things and the quality of care that you bring to everything. I look forward to that collaboration continuing with Gary Burlingame, our new president-elect. It is true that AGPA presidents leave reluctantly at the end of their term because they love this organization and the window onto the organization that leadership provides. I appreciate, Eleanor, what it means to you to step down after 4 years as president. Scott Rutan, however, has noted that if you somehow end up with a third term, he's going to launch an investigation. There are other important transitions I want to acknowledge. Thank you to Karen Travis for leading the Foundation for Advancing Mental Health to great success and reach. Many people in this room are grateful to the Foundation for the support it has provided to attend the conference and the opportunity it provides to become part of AGPA. And I want to welcome Daryl Pure as the new chair of the Foundation. Scholarships are so important. It is not unusual to see a trajectory of a young group therapist come here on a scholarship, join the organization, connect with a mentor, get involved organizationally, take on leadership at AGPA or in their local affiliate or both, present at AGPA Connect, publish in our journal, and get elected to leadership and governance. That is a great path, and for those of you who are here today on scholarship, I hope it is a path you will pursue. I want to also welcome our outstanding newly elected members to the Board of Directors, including for the first time young professional and student reps. This reflects an important evolution in our organization's governance. I'm also very pleased, beyond words, frankly, to have my wife Bonnie, our daughter Talia, and our son Noah and his wife Haley, and our precious granddaughter Lucy here. Our son Ben and his family are on vacation, but here in all other ways. Bonnie, my wife, is a high school math teacher. We have often noted how similar the work of teachers and psychotherapists is. We both aim to remove obstacles to our students and our patients' growth and development. On a different note, it is so disappointing that our colleagues from China, who have been attending AGPA in ever larger numbers and with great enthusiasm, have not been able to travel here because of government restrictions due to the coronavirus. They are experiencing painful isolation and severe restrictions on movement in their own communities right now. We miss you here. I am pleased to note that many AGPA members are presenting online to our Chinese colleagues about coping with pandemics and community trauma. Tens of thousands of our Chinese colleagues are tuning into these sessions. If ever there was an endorsement for online groups for therapy, support, and education, this is it. We hold these friends and colleagues closely in mind and welcome them through the live streaming of the conference plenaries and other aspects of the meeting. It is evident, I'm sure, that I have deep regard and affection for AGPA and the wonderful people who are part of this remarkable organization. The American Society of Association Executives Conference, which focuses on building exemplary associations, a meeting that some of us in governance attended earlier this year, underscored that we are a very good association. Not perfect, but pretty damn good. Our lay leadership and our administrative leadership, exemplified by our remarkable CEO, Marcia Block, and the administrative team of Diane Fearman, Angela Stevens, Jenna Tripsis, Katerina Cook, Desiree Ferrance, and Angie Jeremilo, outstandingly effective and care so deeply about AGPA and our members. Let me add that there is no truth to the rumor that Marcia fractured her foot in a hotel contract negotiation. But you should see the other guy. AGPA is a complex organization, and my 2 years as president-elect have opened my eyes to its inner workings, akin to my learning what really goes into preparing a great meal, in contrast to my usual fashion of sitting down just in time to eat. My wife might add that I still have a fair bit to learn on that front. I've had the privilege of meeting and talking with many of you through the year and in the weeks before the conference, and of course at this meeting and the Tri-Org and Joint Board Leadership meetings. These interactions reinforce for me my conviction that the world needs us more than they realize, and we have so much of value to offer to our patients, to our members, to our colleagues, and to society at large. I recall vividly my first AGPA conference. Irv Yalom and I were to present together, but he had to cancel at the last minute, leaving me to present alone for the first time at AGPA on inpatient group therapy to a host of people whose work I had studied and whom I viewed as AGPA and group therapy icons. 3 future AGPA presidents attended the session: Bob Klein, Harold Bernard, and Howie Kybell, all influential in AGPA and later in my personal development within AGPA. I overcame my anxiety about feeling I was in over my head, and the session went pretty well. That was 35 years ago, and I'm happy to note that I'm leading those frontline groups again. Inpatient group therapy was also the focus of the first group therapy paper I published in our journal. And for those embarking on academic writing, let me tell you that it took me twice as long to write that single 20-page paper than it took Irv Yalom to write the 300-page group text based upon that work. Let me now return to my focus for today. What group work has taught me has been invaluable personally and in organization and leadership work at the university, at the hospital, and I would add, as a baseball and hockey coach. I hope to highlight the principles I have learned and how I think these offer great value going forward in AGPA and beyond. I believe so strongly in these principles that I have borrowed from Robert Fulcom's popular idea, all I really needed to know I learned in kindergarten. What I learned in group therapy. What group has taught me is the impact of group therapy when it is well conducted and delivered. The work we do is a triple E treatment. Research consistently shows it is effective, it is at least equivalent to individual therapy, and is efficient with regard to therapist resources and cost. It is widely applied in virtually every clinical setting across the country, in most agencies and institutions, and ever more so with the medically ill. But it is often implemented poorly by practitioners who are inadequately trained and inadequately supported, as we have confirmed through the recently completed agency survey task force that Claudia Arlo and Martin Whittingham did. This work is not easy work to do well. There is a large hunger for training and professional development. AGPA, in collaboration with local affiliate societies, is very well positioned to support that training. Remedying the quality gap is essential if we are to change the experience of demoralized practitioners and dissatisfied clients that fuels stigma and undervalues this set of powerful treatment modalities. Quality matters. Standards matter. And demonstrating that is an important task that we are taking on through education, advocacy, training, and community engagement. We see the value of educating colleagues, consumers, and insurers about quality group care and what the designation of a certified group psychotherapist means. This also involves telling our great story well, with consumer-facing information and a refreshed website that is welcoming and communicates the way we need to communicate today. We must support and promote training in group therapy. Our newly revised core principles text and course exemplifies that, and we are using that across North America and in China and internationally. Les Green and Francis Kaskalakis and their colleagues deserve our appreciation for the great work they have done in bringing that book to life. That text and the ongoing work of the Science to Service Task Force and our journal serve to create new knowledge and to translate qualitative and empirical research into actionable practice. The recent designation of group psychotherapy as a specialty is a gigantic step forward for us. We need to leverage that now so that group therapy is accorded the status that its effectiveness warrants. Let me now dive deeper into the power of group and what group has taught me. A traumatized combat soldier in a specialized group treatment program reported to me that he experienced more benefit from 1 week of intensive group therapy with his combat comrades than 5 years of individual treatment. Let me paraphrase his comments. The cohesion of my platoon built cohesion in the group therapy, and we all had confidence in the co-leaders. An emotional cascade opened me up. Other self-disclosure facilitated mine. The group enabled me to work through my trauma and grief and the moral injury of war and combat. Everyone in the group understood me. They got it. He was describing eloquently the healing context of the group. A chronically depressed and self-attacking member of a group that I lead, with whom I've had many authority and power battles, none I believe were my doing, recently noted, "I love this group because in the world outside, I have always been a jerk, antagonistic, and looking for battles around power. Inside this group, I am a mensch. I'm finally beginning to see that transfer to the outside world. Group therapy promotes its members' capacity to redefine themselves or recalibrate and see themselves more clearly through the eyes of others. I've seen groups support their members in the face of mortal illness, promoting effective coping, better communication with loved ones and care providers, reducing isolation, lessening pain, and improving quality of life. What group has taught me is that confronting existential threats and working through trauma is best done in the trusted company of others. As Judith Herman notes, the solidarity of a group provides the strongest protection against terror and despair and the strongest antidote to traumatic experience. One of the most compelling illustrations of the impact of training on quality of care and the power of group therapy, delivered in the in-hospital environment of the acute care inpatient psychiatric unit, was described recently by Martin Whittingham and Donna Markham in their work at Mercy Behavioral Healthcare, a large behavioral U.S. healthcare network that provides care to 13,000 clients annually. They invested in the training of 60 providers across this big Midwest network, coupled with ongoing measurement and feedback to group leaders. I know this study well because I had the opportunity to do some of the early training and consultation. What were the results? Significantly improved clinical outcomes, significantly improved patient satisfaction, significantly improved healthcare provider morale, and significantly reduced critical incidents and aggression. The group program transformed care from beds and meds, how awful a statement is that, into meaningful engagement with patients. The group work permeated and benefited the entire culture of the organization. What group has taught me also is never to underestimate the impact of even a single encounter. Even in a training setting, it can be transformative. A participant at a local affiliate society to which I was invited to present shared with me in a demo group and I recount this with her permission, that she pushed hard against her constitutional avoidance and shyness to participate in the demo group. Why? She had wanted to overcome her lifelong aversion to being in the spotlight, but even more importantly, she had heard me present on groups for women with advanced breast cancer, and she wanted to thank me for saving her life. That stunned me and all of us in attendance into a powerful silence. She went on to describe that she was in the audience 10 years ago, and my presentation prompted her to pursue her first mammogram after years of delay and avoidance. She was diagnosed with early breast cancer, treated effectively, and is now cancer clear. Her natural inclination would have led to further avoidance and likely a much worse prognosis. She was proud to claim that and to tell me that now directly in front of her colleagues. Groups help people take their rightful place in their lives. What group has taught me is how we can use groups to promote our colleagues' support and to promote psychological safety in the workplace, to reduce burnout, promote stress management, and enhance resilience. And I've seen the impact of groups for intensive care unit nurses meeting in a circle, all of us wearing masks, eye goggles, gloves, and personal protective equipment, supporting one another in dealing with viral and emotional contagion in the context of SARS a number of years ago in Toronto. Even without the extraordinary strains of COVID-19, the coronavirus, the burden of contemporary clinical work is skyrocketing. Suicide rates for physicians is 3 to 4 times higher than that of the national average. The United States loses the equivalent of 1 to 2 medical classes a year to suicide. A recent article in JAMA, a leading medical journal, sounded an alarm about this crisis. Healthcare is more and more isolating. Technology isolates us, financial pressures and unrealistic targets oppress us, and the work gets depersonalized. JAMA notes that the loss of social connection is literally killing us. We are hardwired for connection and social support, and we neglect it at our peril. Scores of studies show the neurobiological underpinnings of these principles, and we know that groups are powerful social connectors, and we need them ever more today, as those of us who heard Jonathan Haidt yesterday present. What group has taught me is that belonging should boost self-esteem. We should be proud of the groups to which we belong. I feel that each day in AGPA. Group cohesion emerges from our task and our bond. But overall cohesion in the organization must be informed by those who feel less connected. A high overall or average cohesion score matters less and may even be noxious to someone who feels on the sideline. And there can be great anxiety about knowing how to enter a group and finding a place of belonging. Our members, particularly our new members, require more clarity about how AGPA works to reduce that entry anxiety and to demystify the experience of participating. Like good pre-group preparation, we need to clarify our processes to promote engagement and align expectations. I want to thank Mark Azule for his work on that front. Dialogue with our members is key, in person, through our community meeting, social media, and our listservs. The best group experiences emerge as a co-construction of all the members. In that spirit, let me add a pitch here. There are a vast number of leadership opportunities within the organization. We need you, and you will garner much more by being closer to the action. How many such opportunities exist in AGPA? Glad you asked. This is my estimated tally. There are over 200 leadership positions and innumerable participation opportunities. Hundreds more participate as AGPA Connect presenters and authors who submit to our journal. Consider our role on one of our 3 boards, as one of our 16 special interest co-chairs, on our task forces, our fellowship and awards committee, e-learning, the International Journal of Group Psychotherapy Board, AGPA Connect committees, and the Affiliate Assembly. We are a big organization with multiple components. We should aim to create synergies through good communication across our internal boundaries. These opportunities for leadership and belonging to a smaller unit, a functional subgroup, are a great way to engage locally and with the larger system. What group therapy has taught me is that the lived experience of inclusion is paramount. We are responsible for promoting opportunities for engagement and belonging for all our members. Leadership should provide what McCulnacher, using an attachment paradigm, describes as socialized leadership. Leadership that promotes a sense of security and psychological safety for all its members, a place for comfort and creativity, a safe haven and secure base that promotes both exploration and tolerance of vulnerability. What group has taught me is that every voice carries import, and even, or perhaps especially, the dissonant voice must be embraced for carrying an element of the truth that may be quietly shared by others. Inclusion is a central part of this. The recent AGPA election has reinforced our efforts at broadening our membership and our governance by being more representative of who we want to be, an organization that not only welcomes diversity, but seeks it. Our leadership needs to reflect the organization and its members across dimensions of race, culture, health, ability, age, economics, gender identity, and sexual orientation. And we must be an organization that is willing to learn and grow through the difficult dialogues that Stanley Sue has described. Who better than us, amongst the most skilled group therapists in the world, to engage in these difficult dialogues that society at large struggles with and resists? Who better than us to make the invisible visible and to take proper responsibility to challenge the silence around race, discrimination, trauma, power, privilege, and oppression that permeate the societies in which we are embedded and affect the mental health of our clients and the well-being of our members? Thoughtful dialogue and recognition of the experience of each person is how we transmit respect and understanding. It is how we promote growth and, when necessary, facilitate repair. This is not a political issue. Rather, it is a psychological issue of the highest order, because respectful dialogue and the work of truer appreciation of one another's identity fosters a key aspect of mentalization, what Jeremy Holmes describes as knowing ourselves from the outside and knowing others from the inside. In that spirit, we are expanding our Diversity, Equity, and Inclusion Working Group into a task force. Their guidance and input has been invaluable. That was the focus of Monday's excellent joint board leadership training session, and much thanks to Sofia Aguilera, Michelle Ribeiro, Karen Konumera, and Wendy Friedman for their hard work with us. Last month, I led a tea group for University of Toronto psychiatry residents. I suspect it could have taken place in dozens of programs across the country. The experience of one member is telling. She is Indigenous, but as she notes, she does not look First Nations, and, quote, I pass for white. We pride ourselves at the University of Toronto as being at the forefront of inclusion and as being highly sensitized to issues of discrimination. Yet this woman shared with us in that group that every day she battles against discrimination and must determine how to respond to routine microaggressions and microinvalidations. She implored us, we all need to care and protest discrimination. It can not only be her, she said. lest I exhaust and demoralize myself or have my identity constricted into a two-dimensional view of myself as that angry indigenous woman. She did not want to sacrifice herself further to educate us. We should take personal responsibility to know better. Yet she hated to miss an opportunity that could increase our awareness of bias and racism because she believed that most of us wanted to do better, earnestly so. That was her dilemma. This young resident struck me with the awareness that there are many important steps forward, but empathy for the other and shared responsibility for combating discrimination and racism are essential. What group has taught me is that our society is marked by deep roots of racism and discrimination, such that unintended triggers can emerge in routine communication. Our therapy groups are embedded in the social context and embedded by the social unconscious. We are vulnerable to social pressures and the polarizations that exist all around us. On the one hand, we will experience what society at large experiences. But as group therapists, we see things others do not. I say that without arrogance, but with appreciation for the great value of understanding the principles of group process and the concept of psychological overdetermination. That understanding can help us address the growth of tribalism in our society, as described by Chua and Rubenfeld. Tribalism creates a zero-sum game philosophy. For me to benefit, you must lose. Your gain is my loss, whether it is status, money, resources, power, or opportunity. That is why everyone in our society feels under threat at the same time. It is a sign of primitive regression in our society. Therapy teaches us how to counter the move beyond tribalism in our society, the narcissistic elevation of one subgroup, and the cruel disparagement of another. This will require our willingness to address fraught conversations, the humility to acknowledge our limits of knowledge and understanding, the need to learn about the experience of our diverse clients and colleagues, and the capacity to take risks, trusting in the potential reparative process of diverse but fundamentally decent people working together to make our world better. What group has taught me is to embrace complexity and discard simple explanations. Group therapists know how to communicate, and that is also how we can impact society around us. It will take all of our communication and meta-communication skills, and our knowledge that groups that extrude and scapegoat inevitably undermine themselves, their group stability, and their group health. I am normally fairly comfortable in expressing myself verbally. I believe that language is a surgical tool of the group therapist, and that we should practice our use of it like the athlete practices his sport, repetitively and consistently. Yet at times, in this domain, I find myself hesitating, thinking how what I say or write could inadvertently antagonize or inflame when that is the last thing I would seek to do. What group has taught me is that interpersonal communication is an amalgam of the vectors of power and the vector of affiliation. Our relationships and communication should be guided by an adaptive balance of those two forces, building upon affiliation as an offset to power-driven communication that is shaming and humiliating. Affiliation, not power, is a path to inclusion and engagement. The principles of meta-communication, communication about our interpersonal processes, help guide us here. I have learned from group therapy to try to be authentic, direct, to use language to engage, not to overpower, to show respect, to align my intent and my impact, to make no assumptions that I got it right, to check it out. And when talking about a person, never say never, always avoid the word always, and don't otherize or devalue. Call a chair, don't call it a goddamn chair. We all need to help one another in this process. When I worry about my ability, our ability, and society's ability to do this, I take heart from one of the most compelling lectures I have heard at a group conference. It was given by Judge Albie Sachs at an IGA conference in London several years ago, and I thank John Schlabapersky for inviting me to attend. Justice Sachs is one of the chief architects of South Africa's post-apartheid constitution. He is an advocate for justice, truth, and reconciliation, has the best vehicles for social repair, and as a way to diminish what he refers to as the hard vengeance that terrifies, fragments, and polarizes society. Justice Sachs described meeting later in his life with a South African government agent, a man named Henri, who had been ordered to assassinate him in a car bombing. The government sought to silence Sachs's anti-apartheid advocacy. Justice Sachs lost an arm and an eye in the car bombing, but survived. Henri, the commissioned assassin, sought to meet Justice Sachs, seeking repair through his personal approach to Sachs and then his later testifying before the Truth and Reconciliation Committee. At their first meeting, Judge Sachs encouraged Henri's plan to testify before the TRC, but doubting Henri's authenticity, they parted without a civil handshake. Judge Sachs suppressing the animated wish to say, "I would normally shake hands, but as you see, I cannot." They met again quite a bit later, after Henri's testimony at the Truth and Reconciliation Commission, and his clear work and commitment to make South Africa a more just society. This meeting ended in a warm handshake. Judge Sachs learned later that after that encounter, Henri went home and cried for the next 2 weeks. What group has taught me is the value of holding the dialectic. We can hold together two opposing ideas. If evolution of our species, thousands of centuries ago, jumped ahead when our genetic ancestors developed an opposable thumb, our future survival depends on our using our opposable mind, being able to see simultaneously both sides of an issue or conflict. Group therapy teaches us about intersubjectivity. There are multiple subjective truths experienced by members of a group at most moments, rather than a single objective truth. I recall a therapy group in which two members expressed vitriolic hatred for one another, for their politics, for their life choices, their attitudes, their appearance, their choice of employment. In exasperation, one turned to me and exclaimed forcefully, "This group is not big enough for the two of us. Either he leaves or I leave." I responded that they both had a right to be here, both needed to be here. Group therapy was not a TV Western. This town was big enough for them both, and there would be great utility in working their difficulties out, and we would help them, as was borne out over time. Group therapists have another great strength. We have a great strength within this organization. Our values and our interests are perfectly aligned. We recognize as mental health experts that there is no health without mental health, and there is no mental health without social justice and equity. What matters to us and how we work on what matters to us are well aligned. What group has taught me also is that we do very challenging work because our clients' difficulties test our capacity to understand and respond effectively and therapeutically. It is often isolating work, both due to our professional commitment to confidentiality and to our self-silencing shame when we have not performed up to our ego ideal. It is for these reasons that I believe we benefit enormously from being part of a community of practice. We all do better work when we are connected with our colleagues. I believe it is true for those who are new to the field and for those with years of experience. It is a psychological and biological fact. Let me illustrate personally what I mean. At a conference at which I was invited faculty, a woman volunteered to join a demonstration group I was leading, only to harshly and publicly criticize me for my presentation. for my teaching, for my thinking, my material, my methods, my style were all, in her view, crap. She left virtually no part of me untouched by attack. I was overloaded with feelings of vulnerability and shame. Yet I reminded myself, she volunteered for this demo group. If she was so critical of me, why not just walk out and ask for a refund? Why seek the demonstration group? A key task of a demonstration group was protecting her from being scapegoated by the other demo group members who jumped to my defense. Identifying why she would seek to participate in this group remained a puzzle in the limited time we had, but it was certainly a signal that more was at play than met the eye. I was affected by her attack, not the least part of which was its public nature, which is, of course, what happens for all group leaders and especially our trainees. I worked hard to salvage a constructive experience for the day. An intervention by a colleague, Greg Crosby, who was in the audience that day, was very helpful. He texted me after the session and said he had information to share that would be helpful. He too was puzzled by this person's attack and by chance ran into her after the event and inquired why she was so critical. That led readily to disclosure about her learning difficulties. She was upset that I had used PowerPoint and a didactic approach to the morning, rather than being entirely experiential. She described that due to a learning disability, academic presentations killed her. She elaborated to Greg that because of her learning disability, she felt humiliated in most courses of study in college, and she had completed her training only with significant learning accommodations. She had weathered much pain in her training. Greg asked her whether she had ever protested this before in such a personal and powerful way, to which she replied, "Not until today." That information helped settle me enormously. It underscored that this individual was seizing an opportunity in this group to do something she had not been able to risk doing in the past. She could protest and perhaps offset her familiar feelings of failure by projecting them onto me. There's no doubt more to say about her, but let me return to my experience. What struck me is that I am an experienced clinician with many years of practice, and on the cusp that week, coincidentally, of receiving a significant honor. Yet my sense of self as a therapist and my understanding of my work was severely shaken by her attack. What was very helpful to me in regaining equanimity was talking with a trusted colleague who saw what I did not see or did not know. In this instance, Greg had additional information regarding the backstory. Supervision and consultation provide that, and we need to access that at all stages of our work. What group has taught me is the need to attend to process. A key we ask ourselves is, why is this happening in this way at this time? Our process skills are like X-ray vision. We see things others don't. The current coronavirus epidemic brought back echoes to me of a meeting 10 years ago as my hospital was ramping up preparations for an impending H1N1 pandemic onslaught. This was several years after SARS had traumatized Toronto and a number of hospitals, mine included. In this planning meeting, all of the hospital chiefs and our CEO were present. One senior colleague was critical of the manifest anxiety some in the room were feeling, particularly one physician who had been the forefront of our earlier SARS battle. This senior doctor accused his anxious colleagues of overreacting and frankly being hysterical. He was criticized in turn for being in denial and that his blindness would lead to our catastrophe. The tension in the room was mounting and getting increasingly personal. I mustered my courage and broke in. I commented that we might best understand this tense polarization as reflecting two cardinal ways people respond to a trauma: through denial and negation, or through dread and catastrophizing. We and our hospital would best be served by recognizing this, stepping back from this polarization, and finding ways to recenter ourselves. I was apprehensive, but things settled, and we quickly returned to our work task. Afterwards, one of the protagonists, known, by the way, for having a stigmatizing attitude toward mental illness and mental health professionals, expressed to me his profound appreciation for the perspective psychological understanding brought to the discussion. But to access that kind of process perspective, we need reflective space, and one cannot do that alone in the midst of an emotional storm. Principles and values anchor us. Community anchors us and allows us to manage our reactivity. The best group therapists employ deliberate practice. They study, they seek consultation, they seek feedback, and AGPA provides unbelievable opportunities for that. They anticipate strain in the work and use that strain as an opportunity for repair and growth. They appreciate the great value of thoughtful persistence. How often have we worked with someone who was stuck for a long period of time and for whom our unwillingness to give up was later rewarded with progress and recovery? The best group therapists know that experience alone is insufficient without a commitment to developing one's craft. Experiential training is unique in advancing that self-awareness of oneself as a therapeutic agent. The capacity to hold the dialectic of therapeutic confidence and therapeutic humility is a powerful resource to us. The trainees I supervise in group therapy, even those who don't lead groups in later practice, have repeatedly told me the following about the value of their group therapy training. I have learned how to appreciate how group, individual, and societal dynamics affect what is happening in my group at any moment. I no longer look for simplistic explanations without processing what is happening and why. I've learned to use myself as a therapeutic agent. I've learned what it means to work in the here and now. I've learned how better to speak to patients empathically, knowing that everyone in the room is watching me, and that I am not only speaking to the group member I'm addressing, I am modeling what compassion and mentalization look and feel like in real time. I now appreciate that we can only hope for our clients to be able to mentalize about others when they have first been mentalized about. I have learned to welcome countertransference as a source of data that will inform either me about me or me about my patients, and sometimes both. I have learned to identify and to speak to dilemmas rather than to avoid them. I have learned not to assume that my impact and my intention are aligned. A group is a precious thing. Once created, nurture it. It requires continuous maintenance. I have learned if I make an error, I need to own it. Therapists should never protect their self-esteem, at the expense of repair. I have often said in supervision that I have shared with patients the following: I am sorry. If I understood then what I know now, I would have approached this very differently. Can we try to do that now? I suspect that I'm not alone amongst those who have given the AGPA presidential plenary in thinking back to my first AGPA meeting and reflecting on the trajectory of my involvement in AGPA. I assure you, today was never in my imagination. I also assure you, as Eleanor noted earlier, that not only the current leaders, but the future leaders of AGPA are in this room. I have great respect for the expertise and dedication of the group therapists in this room and the way in which you work to expand the reach of your work to meet the demands of clinical populations that emerge day after day in our society and in our communities. I have hoped to share with you the things I have learned from group therapy. These principles guide me every day in my professional and personal life. It is why I believe so strongly that there is no part of contemporary society that would not benefit from more exposure to the way that we think, the way that we talk, and the way that we are. Seize the opportunities ahead. Let's work hard together to grow and sustain this remarkable organization and keep it one that we will all be proud of and that supports us all in doing the essential work for our clients and our communities. Thank you.